So nice to see everybody here, and hopefully it won't rain. I'm a cardiologist in Victoria, and I want to give this rally my complete and utter support. Because the collapse of primary care in this province affects everybody, not just the family doctors. Today, do you know that over a third of the patients that we send home after a heart attack have no GP to follow up with? Nobody to renew their medications or adjust them or see the complications that may develop. They're left to find basically a walk-in, which, as you've already heard, was probably closed by now. So they have nobody to help navigate their recovery from the heart attack. You see, qualified care by a physician after discharge is not an optional extended warranty program. It is integral to the patient's care journey. And the ultimate outcome of that journey depends as much as what happens afterwards as what happens in hospital. And so many don't have that opportunity anymore. And what's even more frightening is how many might have avoided the heart attack or stroke or advanced cancer in the first place with adequate primary prevention from a skilled, caring family doctor. Public health has taught us that it's the small things applied to everyone in a population that makes the big differences in a population's health, not the big interventions applied to just a few. So how did we get to this mess? Well, it certainly didn't happen overnight, but it has become dramatically worse over the last 5 years under Mr. Dick's watch. Let me suggest to you a couple of myths promoted by this Minister of Health that are certainly part of the problem. Myth number one is that a family doctor is an expensive, frivolous luxury that we really don't need. His actions have always suggested this, but last week in this building, he basically just said the same thing by saying that better care was provided by nurse practitioners. Now, what are the facts? Don't get me wrong, nurse practitioners are a wonderful member of the healthcare team in a supportive role. But they're not physicians, and they can't be expected to provide the same kind of care as a family doctor can, and they're not cheaper. Did you know BC pays a nurse practitioner more to see a patient than a family doctor? Now, even more importantly is that Mr. Dix appears to have set one group against the other, and that doesn't help. We need to work together to keep this population healthy, using their skills and their training. We're not in competition with each other. You know, I'm in awe of what family doctors do. Almost everybody that I see coming into my office has got heart disease, which makes it easy because I can focus on one small area. But the family doctor, on the other hand, are on the front lines of medicine. The patient who walks into their office could have flu or cancer. They could have a headache or a brain tumor. They could have an infection or diabetes. It takes skill and training to diagnose and to treat. Mr. Dix, if you're listening, family doctors are not frivolous, they are foundational to our healthcare system. They cannot be replaced or ignored as you have tried. A recent report unfortunately ranked Canada 10 out of 11 countries in the world, ahead only of the United States in terms of healthcare. But it said that the most important aspect was in fact a strong primary care system. All right, now myth number two. Myth number two, and this is one of Mr. Dick's favorites, UPCCs will save the day. Now, the government has spent $100 million on UPCCs across the province, and today, none is fully staffed and few provide any longitudinal care. They basically provide walk-in care 2 to 3 times the cost of a family doctor. In Victoria, less than 3,000 patients have anything close to longitudinal care through a UPCC. But here's the part that the minister doesn't seem to understand. You can put a UPCC on every street corner, but they'll be of less use than a Tim Hortons unless they've got doctors in them. Qualified doctors providing long-term comprehensive care. So look, before it rains, what to do? Mr. Dix, I'm sure you learned your 3 R's in school, so here are 3 more for you to help focus your thoughts as you try and solve this problem. First of all, let's respect your family doctors. Respect them for the incredible work they do. Do not trivialize their work as you did last week. Statements that betray an ignorance of the fact. The people of British Columbia need family doctors and a lot more, and they are not replaceable. That's right. Number 2, reimburse them adequately for their training, skill, experience, and hard work. A GP sent me a screenshot the other day of a billing for the same patient for the same office visit 4 years apart. And the difference of the MSP remuneration was 39 cents. That's insulting. And the third thing, Mr. Dix, you need to do is to resolve, as we've heard today, to do this now. Not next year, not after the election, not in the future, now. Fiddling with the fee schedule is deck chairs on the Titanic. It's not going to avoid the catastrophe. Time to make the major changes is now. Patients in this province are suffering, and I fear dying as a result of adequate primary care. Mr. Dix, there's nothing wrong with saying that a plan isn't working. There is something wrong in ignoring the facts that show that it's not working and not doing anything in response.